Brought to you by GTA, your island, your network.
Department of Public Health Director James Gillen says it's nothing personal.
We're making basically a business decision. It's what we can afford.
On Wednesday, Public Health announced starting December 1st that emergency services only will be covered for Medicaid and MIP beneficiaries at the Guam Regional Medical City.
This suggestion to stop the services and limit to emergency only was based on the advice from CMS Medicaid. They said that is something you can do right away.
The decision was made once Public Health became aware of the reimbursement rates for GRMC.
Medicare generally sets the fees, okay, and our program follows the Medicare fees. So when we found out on the 16th of November that the Medicare per diem for GRMC was going to be $5,075, it was a shock.
That amount is 4 times more than the per diem for the Guam Memorial Hospital, which is around $1,100. Gillen says within days of learning of the amount, they received a stack of bills dating back to January up to September. The estimated cost for Medicaid for GRMC was $22.9 million, and for MIP, $12.7 million. Gillen says they have the authority in the 2017 budget to help pay for prior year claims. However, it still isn't enough. Part of the business decision, he says, is determining why GRMC's rate was so high.
Because if we, for the sake of argument, and I think it's a legitimate argument, if the services at GMH are the same quality as the services at GRMC, why would I pay 4 times the rate when I can get it at $1,100?
GRMC issued a release stating they were extremely concerned about the decision, adding this doesn't just reduce medical services to residents who are economically disadvantaged, but also violates an agreement between GovGuam and GRMC.
They want to argue that we're breaching the contract. That's between the attorneys. We're going to talk about it. We believe there's room to negotiate some things. We think there are services that they provide over there that may not be available at GMH. We'll have to work that out.
And despite the notice, GRMC CEO Margaret Bengtson says they will continue to provide full services to Medicaid and MIP beneficiaries. She adds, quote, "This is in line with our contractual obligations and more importantly, with our commitment to raising the quality of health and life on Guam." Following GRMC's statement, Gillen says they contacted CMS today, which further advised GovGuam to instead give GRMC a 30-day notice to terminate the contract. A letter is currently in the works. That means GovGuam will continue to cover GRMC at their current per diem until this new notice goes into effect. Reporting for Guam's News Network, I'm Ken Quintanilla.
Brought to you by GTA, your island, your network.